Hey there, I'm Kevin Houlihan, CEO of Workflow Services. Welcome to our ECAPS Watch podcast. Today, I'm excited to be joined by Lisa Faast. Lisa is a pharmacy owner, compounder, consultant, and businesswoman with over 20 years experience in community pharmacy. Lisa's passion is helping independent pharmacy owners stay profitable and love pharmacy ownership again. And she's the founder of Pharmacy Profit Summit and Pharmacy Badass University. Lisa, this podcast is focused on ECAPS, which expands the opportunities for how pharmacies can operate. Can you share more about your company, DiversifyRx, and how you support independent pharmacy evolution?
Absolutely. Thanks, Kevin, for having me. And here at DiversifyRx, my goal is to help every pharmacy owner not just survive, but thrive and actually love owning their pharmacy without it being chaotic and like running their entire life. So I just love working with pharmacy owners and helping them just create pharmacies that are amazing for their patients and amazing for themselves to own.
And so a lot of that is around change and evolution, right? Like you're helping pharmacies.
Absolutely, man. One of the one of the worst things a pharmacy owner can do is stay put and stay in
Yeah.
place.
So ECAPS is an interesting thing because it's federal legislation that recognizes pharmacists as providers in the eyes of Medicare. But that's kind of new, but not totally new. There are other payers that recognize pharmacists as providers for respiratory tests to treat. How do you think about the importance of ECAPS if we can get that legislation passed and how that will change things?
It's certainly not, the miracle bill that we all would like, but I think it's a baby step in that direction towards the finish line where pharmacists, get recognized as the same as every other healthcare provider that can bill to Medicare. But it is certainly a step in the right direction with the testing and the respiratory angle that they focus on. Obviously, it would have been nice to have this even earlier. Pharmacists saved the day when it came to COVID. But a lot of pharmacies are providing these services already. So it's just going to open more revenue streams, which we all need more diversification of revenue streams in order to, stay afloat and stay profitable as a pharmacy. So it's exciting legislation. It may not, I know some people have like kind of hands off on it because it isn't everything we want, but
Mm.
I don't think we're ever going to get everything we want in just one swoop bill. It's going to happen in chunks, and I think this is very much the first domino that has to fall in order for us to continue down the line.
Yeah, I mean, don't let the perfect be the enemy of the good, right? Like make
Yeah,
some progress
yeah.
forward. And so you're helping pharmacies change and change with a whole bunch of things. Some might be clinical services and medical billing, others might be other operational things. Can you talk about some of the factors that you see when you're talking to pharmacies about growing and changing, things they should consider, things that get in the way, ways that you help them move forward?
Yeah, the biggest barrier usually to pharmacy owners changing is the pharmacy owner themselves, whether it's misconceptions or buying into the mythology, specifically around medical billing and clinical services. They think they have to like blow up their business and rebuild it in order to add those kinds of services. And that is certainly does not have to be the case. A lot of things, a lot of clinical services and medical billing services doesn't even have to involve the pharmacist. A lot of the heavy lifting can be done by cashiers or technicians. And then the pharmacist comes in, does what they need to do, and then the pharmacists leave and the technicians or clerks finish up. Very much similar to when we all go to the doctor's office, right? We get checked in by somebody, our blood pressure and weight and other vitals are taken by somebody who's not the doctor. The doctor walks in, does their thing, they leave. The medical assistant or nurse comes back in and does their things. And so logically, we all experience that as a patient, but somehow when it comes to pharmacy, these pharmacists think they have to do it all. They have to do it from A to Z, and then they get overwhelmed and they get burned out. And so my recommendation, whether you want to implement clinical services, medical billing, a synchronization program, delivery, whatever it is look at it as like a sandwich. Somebody else is going to start it, the pharmacist is going to be the meat, and then somebody else will end it on the other side. And it makes it so much easier to implement when they have that right perspective. And unfortunately, too many have let that kind of mythology that it's gonna take all of their work, and they haven't implemented these types of things.
So talk more about the best practices in that sandwich analogy of how it can work with the team culture, right? Because you've got to get someone on the team that's the bread, and where do you source the bread, and what kind of bread, and all that sort of thing.
Absolutely.
H- What's Yeah, how do you get the team aligned? How do you help them get over their fears?
One of the best ways to keep amazing employees is to continually allow them to grow and develop. Um, Pharmacies lose good employees because there's not a career ladder, if you will. There's no way for them to step up. And so one of the best ways to attract good employees and keep good employees is to be able to allow them to blossom and develop their own practice, if you will, to the fullest extent of their scope, right? In a lot of states for technicians, that means, actually giving vaccines, or other things. Point of care testing is a perfect example. So many pharmacies misbelieve that the pharmacist has to be the one to give the test, interpret the test, because we think of ourselves as the licensed person. But point of care testing does not follow pharmacy law. It follows laboratory law, which means any trained employee can do the test and interpret the test. That means a clerk, a cashier, unlicensed person, technician. Once pharmacies realize that, I've had a lot of people adopt point of care testing and be very successful with it because they just misunderstood where the pharmacist's role is in that. But one of the best ways to keep your good, excelling employees happy is to continually allow them to grow and develop and explore new skills so they feel useful. Those kinds of good employees, they want to feel useful, they want to be impactful. And so giving them the opportunity to do that makes them happy.
So talk to me, you're talking about how the team can play a role and different members in the team. How do you think about the labor component of adding clinical services? I think there's a lot of pharmacies that get, oh my gosh, I'm gonna have to hire a bunch more people. And you're talking a little bit about that, of using kind of the right resources that might already be on the team. Do you have examples or stories, or how do you think about the pharmacist perspective on adding these services? Is this going to be a hugely burdensome thing on the labor components of the
Yeah,
business?
I really don't think it needs to be, and I've seen it implemented in many different ways, but it's about optimizing your entire workflow, pushing the tasks down in the sense that if it doesn't take a pharmacist to do it, push it to the technician. If it doesn't need a technician, then push it to your unlicensed personnel, depending obviously on your state. Other things is bring technology in where technology is appropriate. AI bots, that's a big topic. We're going to be talking about the Pharmacy Profit Summit next year. A lot of my members have already implemented AI bots. And so the AI bots are doing the repetitive tasks on the computer, which then frees up hours of time from the staff so that they could go do the human things like test somebody's nose or throat for a test, or measure somebody for diabetic shoes and those kinds of things. So it's about optimizing your entire workflow. That might be automated dispensing technology like a Prada Max machine. It might be, phone messaging systems, but we all have access to technology. Our PMS systems, the pharmacy management systems inside a pharmacy, are so robust these days that most pharmacies don't use just all of the automations that are available inside that system. So my recommendation would be is really look at your workflow, see where areas of automations or optimizations might be able to take place, and you'll find an extra hour or two. You don't actually need that much time again for these clinical services, especially for the higher end employees. Your cashiers, you can even hire somebody, if you don't have cashiers per se, you can hire somebody that's specifically just handling those appointments and the pre-work and the post-work. One of my members does fertility consulting, and she realized that she can do so many more fertility consultings if she hands off the confirming of the appointment, the follow-up appointment stuff to her, assistant, and she just does the actual consulting. And so I think it's just looking at it with fresh eyes, sometimes getting that outside perspective from somebody, in order to really optimize your workflow, which then frees up the time to be able to add these kind of profitable services.
Yeah, it's an interesting story about the fertility consultant. One of the things that I hear a lot when I talk to folks in the market about adding these services, they say, well, the issue is resources. I don't have the resources. I actually think the issue is access to revenue, because with revenue, you can hire more resources. So there you said she can do more fertility consulting. I'm sure that's driving the revenue in her business, which allows her to hire maybe that other employee to help with some of that ancillary work around those encounters that she's actually having. But I think it's an important thing to keep in mind that a resource problem is probably actually a revenue problem. And I'm excited that ECAPS can do a lot to change that, but there's a lot of opportunity that's there today already that people aren't taking advantage of with other payers, or for cash pay for those services, or all those sorts of things.
No, so the ECAPS is obviously very interesting because it's based on your state scope of practice. So because of that, probably a lot of these pharmacies are already doing these things. They might be doing these things and charging cash. They might be doing these things and not charging at all, because we're classic in pharmacy, constantly doing things that we're never getting paid for. And so chances are you might actually already be doing this. But when an opportunity comes, once it's here and it's perfect, you're already a little too late to the party of kind of getting started in order to really capture the market. Those forward-thinking pharmacies are the ones that are prepared and doing as much as they can. So when something like this comes down the pipeline, assuming it gets approved, all of a sudden this whole new billing opportunity is open, but they're not starting from scratch. They've already got their program. They've already been doing point of care testing. They've already been doing some clinical consults. And so all of a sudden it's just a few tweaks to be able to now open up this entire new revenue stream that will be for billing. We may not know exactly what that looks like at this point, but it's going to open up opportunities for sure.
Yeah, so talk to me more about that. Talk to me about waiting too long to get started and sort of missing a boat. Have you seen that happen in other ways with pharmacy evolution?
Yeah, one of the most greatest and recent examples is with GLP-1 compounding. Whether you're a compounder making your own or selling from a 503B pharmacy as a 503A pharmacy. And, we were compounding, I say we, some of the global we of me and my friends and partners. 4 years ago, we were compounding semaglutide when it first went on the shortage list. And, as it started to become off the shortage list earlier this year, I had pharmacies reaching out to me saying, hey, I'm finally ready to start compounding. And it's like, you got 2 weeks left. It's like there's not enough time to get that started. And so you really have to be prepared and jump on things early. Nothing lasts forever, right? It doesn't matter if it's 6 months or 60 years. At some point, something's always going to end. But if you're not ready as a pharmacy, if you don't have your operations firm, you don't have them optimized as much as they can be before the next new technology comes out, if you don't have your revenue streams and prescription systems all in place, you're never going to be ready to take that next opportunity. And so even with ECAPS, obviously this is the very beginning of what's hopefully a long line of extra pharmacist billing opportunities. There's a lot of pharmacists that'll be like, hey, I don't do a lot of COVID testing. I'm just going to sit back and not worry about this and not get ready. But what happens when the next bill comes and it is for a lot more services that they're already doing? They're going to be behind the ball and they're going to miss out on a lot of revenue. And it's not just the missed revenue, but it's the market share, right? We always know the first one to the trough gets the most, right? And so when you're the 10th pharmacy in your town that finally adds something, you're not getting a good part of that market share. Whereas those GLP-1 compounders, the first ones in their community, they were first to market, started getting the revenue, and a lot of people trust them because they were doing it longer. So even if somebody new opens up or starts offering that service 2-3 years later, it is just a much tougher hill to climb than those ones that were very first.
Yeah, so I hear you saying that the time is now. Get going right away, right? And I think it can be also probably that pharmacies are capable of more than pharmacy teams are capable of more than they might realize. Can you talk a little bit about that? Have you seen that happen where a pharmacy team is kind of hesitant to get something started because they feel like I just need to get a little bit more prepared, and you can get prepared forever, and then they realize they were already prepared?
Yeah, perfect doesn't exist in pharmacy. We get that because when we're dispensing, we obviously want to be perfect in dispensing, but in business, perfection doesn't exist in business. And so, a lot of the things that I teach inside our membership is structure, everybody having a defined role and then defining what that role is. I love controlling calendars. I use controlling calendars in all of my businesses. That way, when there's clarity, people can then excel. They know exactly what they're supposed to do, when they're supposed to do it. And that actually creates a lot of free time. Time management is one of those things that we all can get better at. It's like a muscle. The more you work it out, the stronger you get. I talk about time management all the time inside the membership. And it's like, once you reach level 1, you listen to it again to reach level 2. And we all can be getting better and more efficient now, whether it's to take advantage of ECAPS, or maybe it's to start workers' comp, or maybe, more DME billing or something like that. Like, there's always another opportunity, but you can't really do those opportunities until you have the strong foundation and you're taking care of your patients. They're not waiting for hours or days. And, you've got to have that strong foundation first before you add anything on top of it.
Yeah, say a little bit more about controlling calendars. Can you just
Yes,
Retail.
they were my solution from having to play the did you game, which is the when the boss walks around and asks all the employees, did you do this? Did you do that?
Uh,
Did you do this? Because that gets old really fast, not only for the boss, but for the employee too. And so one of the things that I recommend for any business owner, but particularly in pharmacy, because it always seems like it's chaos in the day-to-day operations of pharmacy, is you have very defined roles. And that doesn't mean that one person's only stuck in one role, but you have an opening technician role. And there's certain things that that opening technician does, which may be different than a midday technician. And so one week, Bella, your technician, might be the opening technician, and next week she might be the mid technician. And so these controlling calendars lets everybody know that no matter what hat they're wearing, sometimes they're multiple hats, right? Even on the same day, they know exactly what tasks are the must do. Like these ones must be done. And so it creates real clarity. Like one of my pharmacy owners was like, hey, I've been working with my technicians, but they still like argue of like whose job is what. And I was like,
yeah.
you got to define the roles and you got to define it on the controlling calendar, because there should only be one person's job, to send the order at the end of the day. It's
Yeah.
not just any technician, it's closing technician or inventory technician, however you want to break it down in your pharmacy. But when there's specificity and clarity, it allows employees to thrive. And that's usually what a lot of them need, is they need those guardrails, and then they can go glaring fast down the road.
Yeah, that's great. Well, so one of the things as you think about new services and point of care testing might be one of those, but it probably applies to anything, is particularly often leaders or individuals that have a lot of responsibility suffer from a little bit of imposter syndrome, and they feel like, I'm not ready to go. I'm curious for your perspective. I think that a lot of pharmacists are more capable of doing more services today than they realize they are. Have you seen the same kind of thing?
All the time. Pharmacists have, again, we have this perfectionist bone, and we think we have to be the expert, like the number one expert in the entire world to define ourselves as experts, when really it's about knowing more than the person you're talking to. And you're the expert when you know more than the person you're talking to. The other thing I like to remind pharmacists is this is not an emergency room, right? Like you are not, a patient is not running in with their life on the line asking a question about a supplement. It's okay to not know the answer. It's okay to say, hey, that's a really interesting question. I'm going to go verify some information and I will get back to you. We are not on a time clock, but for some reason, as pharmacists, we carry around this little like perfection gland and
Yeah.
think we have to know it all at all times. But that is just not the case. Patients do not expect that of us. That's our own burden. That's our own like
Yeah.
head trash that we've put on ourselves. And so whether it's clinical services with fertility consulting or point of care testing or supplements, anything, chances are you are in the 99th percentile of
Yeah.
people who have knowledge on that. You may not be the most world renowned expert, but you know more probably than the person you're talking to. And so I think the only way through that fire, the only way to gain that confidence is just to do it. You just have to start doing it. Same thing with like even doing videos or webinars for social media, those kinds of things. Like people feel so nervous. It's like, but you talk to patients every
Yeah.
day. And the only way through it is through it. By the time you talk to the 10th patient about point of care testing or fertility consulting, you have the confidence because you've gone through it and done it. So you got to wear that like awkward clothes for a little while, but you will come out the other side with a lot more confidence. And absolutely just do the thing. Whoever's listening to this, whatever you're thinking of doing, just do the thing.
Well, that is amazing. You've given a bunch of amazing tips and motivation here today. The one last question I have, and it was a question that our group over here, knowing that we were going to be talking today, asked was, they wanted me to ask you, how does one become a pharmacy badass? And maybe the ways that you haven't already shared.
Yes, I love the confidence from that when people, at our shows and stuff, we always have them say, I am a pharmacy badass, because it to kind of combat what you were saying, that imposter, like we need to have that internal confidence. And so we do have Pharmacy Badass University. We have opportunities and programs available to anyone. Our lowest basic is $100 a month, which more than pays for itself because we've negotiated tons of discounts within the industry. But even if you don't become a member, you become a pharmacy badass by going forward and continually changing, right? The quickest way to kill your pharmacy right now is to practice like you did 5 years ago, because our industry is different. And so you have to commit to continually getting better and implementing change into your pharmacy. And ultimately, that's the definition of a pharmacy badass for me.
Yeah, and it's an interesting thing, the way that you say that. I think it's completely right. You know, the risk is practicing like you did 5 years ago. That's, you're not saying 50 years ago or 30. It's 5. Like, it is moving so fast, right?
Yep,
It's
absolutely,
incredible.
absolutely.
Yeah.
And it's hard. Change is hard, you know?
Yeah.
If change was easy, we would all change, but change is hard. And to be able to swallow that pill, pun intended, and be able to say, hey, I need to do something different and I need to learn from somebody how to do those different things, that can be really hard for smart people like pharmacists and pharmacy owners. So,
Yeah. Well, Lisa, this was an awesome conversation. I'm leaving energized, and I think a lot of our viewers and listeners will too. Thank you so much for joining me today. It was great to have you.
thank you, Kevin, and thanks for all you guys do for pharmacies. You've helped a ton of pharmacies add those extra clinical and medical billing revenue, and so I appreciate for what you've done for them.
Well, the pharmacy plays a very special role in healthcare delivery in communities, and we're here to support it and expand it and help it thrive. So thanks to all of our viewers and listeners for joining. We look forward to seeing you on the next episode of ECAPS Watch.